Hello, everybody. My name is Jill Swartz. I am the Chief Product Officer of Scientifics, and I'm delighted to be here today with Dr. Kevin Aister from Peak Vitality. Hello, Dr. Aister. How are you today?
Hi, Jill. I'm doing wonderful. Thanks for being here today.
You're very welcome. So we're kicking off Peak Vitality's patient education series, where Dr. Acer is going to be really taking time out of his busy day and schedule to really just educate his patients on what's new. It's so interesting, all of the exciting things that are happening in medicine, particularly in regenerative medicine. But it's so there's so much information out there. So for you to be able to take this time and kind of like dumb it down and really explain to us and to your patients about what's going on and what is this next frontier and what are all these options. It's very meaningful. So I'm delighted that you're taking the time to do this, and your patients should be very, very excited about what they're gonna be able to learn.
Well,
So
well, well, hopefully they're going to be not only intrigued, but very excited like I am. And I can't tell you, I've been practicing medicine for a long time, and this regenerative space that I'm in right now is the by far the most exciting space and the most rewarding space as a physician trying to help patients overcome diseases and their problems. So I am extremely excited to be here today and offer this educational experience and have you at my side and Scientific supporting me is just icing on the cake.
awesome. Well, today you're going to kind of do an overview of the landscape of regenerative medicine and talk specifically about exosomes and the different therapies that exosomes, and the place of medicine exosomes are, and all the different things that they can do for us. So I'm going to let you take it away and really just help teach us what's going on here in this space.
Yeah. So first, where I'm going to start is what is regenerative medicine, right? We talk about that all the time. And very simply, it's medicine that uses the body's innate abilities to heal itself and identifies that process and then puts it back in the body to overcome a disease or a condition. It's very natural. It's been around for many years. And we are now at an exciting point where we're going to add these exosome therapies, okay? And that is really the new frontier here, as the slide says, in medicine. So how does that happen? Where do we start? What is this? So let's start with identifying what exosomes are. They are extracellular vesicles. Well, what does that mean? They are created by the cell and pushed out into the body, okay? And they carry essential molecules, and they are they are very powerful tools that help other cells create health. So that's the overview. But you have to understand that these extracellular vesicles are in your body, and they have been working every day in your body, and we're only starting to identify now what they do and how powerful they are.
Right. And I've heard it said that they used to be thought of as the junk of the cell, right? And now that they found that they are the actual powerhouses of the cell.
Yeah, you are spot on. You know, in the initial work and studies of exosomes, and we've been studying them for almost 30 years now, so this is not something new. We just thought that it was a waste product that the cell made and kicked out. Boy, were we wrong. And now we have these extracellular vesicles. They're in nearly all cell types in your body. They're in all bodily fluids. They are believed to be cell-to-cell communicators. They modify or control inflammatory processes, and they are responsible for creating cell growth or regeneration. They're very small, and I love this. I use this with my patients all the time. You take a human hair and you take the width of a human hair, which is 60,000 nanometers, and they are thousand times more small than that. So you can't see them with your eye, obviously, but they're very specific and what they do and what they are. They're a cargo carrier. The exosome is great, but it's what's inside the exosome that's really exciting.
Right.
And
And
what
I'm sorry about that, but yeah, and that's what you're going to be explaining to us about just how they actually work.
Yeah, absolutely. So, and they're very active in how they work, but their the ability to work is that they transfer this cellular material that's in them to different other cells that are in need. And we'll get more into that. But what are some of the molecules? Well, there's microRNA, there's cytokines, there's growth factors, there's enzyme systems, and they got cell surface proteins. These are all very specific markers or signalers in the biological world that create healthy functioning cells. And that's what we're ultimately trying to obtain is a healthy functioning cell, because if you have a healthy functioning cell, then you create a healthy organ. When you create a healthy organ, you create healthy species. In other words, you have wellness and health. And that's the excitement of this, because these are very powerful, and it is simply done by these healthy cells produce these exosomes, and those exosomes are absorbed by unhealthy cells or cells that are damaged or not functioning properly. And that's the beauty of this.
It's quite fascinating. And I know that just this month, October 2024, a Nobel Prize in Medicine went to the two American biologists who discovered their work in microRNA, which is the key molecule in the exosome. So
Absolutely, that key molecule is what transfers all the data, if you will, from one cell to the next, and imprints on that damaged cell how to start functioning again normally. It's a very
yeah,
powerful tool.
very, very fascinating.
So, you know, they're extremely powerful, and they specifically, in this instance, when you get the release of the exosome and absorption by the exosome into a damaged cell, what they do is they actually target damaged cells. So you put them out, the body puts them out into the system, into your blood, and they actually seek out damage. It's amazing. And
Yeah.
they are there to reduce inflammation. They are there to engage or induce cellular regeneration. That's their only chore.
Yeah, and they can, like you said, they can really target it. It's like they find it, they go to work immediately in finding what needs to be repaired or what's inflamed. And this slide shows this very well, how they are specifically able to target all different systems. So I'd love for you to explain that.
That's the beauty of this is it doesn't, it's very powerful in neurodegenerative diseases. It's very powerful in musculoskeletal problems, osteoarthritis, in inflammatory diseases of the lung, whether it's acute lung disease or chronic lung disease. You can use, they affect heart and heart muscle. If there's inflammatory processes going on there, they work all over the body, including your skin, including your joints, including sexual wellness. And, you know, as we age and we lose some of our abilities there. So this can be used safely and effectively all over your body. It depends on your individual needs. And that's the other beauty of this. This is a specifically personalized targeted therapy that will fix exactly what you need. And the next person next to you doesn't need that, so it won't go there. It's absolutely beautiful in that response.
And exactly this advancement, this is the next frontier. And what they're finding, Dr. Aister, and of course you know this, but we're learning as we advance and study. I mean, Zeo Scientific is a research company. They're identifying or able to identify specific named microRNAs like microRNA 26 that is specific to osteoarthritis. So now that they can truly just match this particular exosome, this tiny, tiny exosome, to target specifically osteoarthritis in the knee. That's just unbelievable.
That is where this is going. It's called engineered exosomes.
Yep.
And we're already starting down that pathway, and it's an absolute beautiful pathway, and it's only going to get better as we refine the techniques.
Yes, that's for sure.
And this is another, as you put this slide up, the delivery methods. It can be used anywhere and in any form. I can give it IV, I can give it intra-articular, I can give it IM into a muscle or a tendon. I can apply it topically. I will use it after microneedling. You can even use it inhalation, which is an ideal method for uh, bypassing or going directly to the brain when there's neurodegenerative diseases, and it's a very effective tool. So these types of extracellular vesicles can be used in a number of different ways and applied in a number of different ways, and they're all relatively easy, safe, fast applications and well tolerated.
Right. So that is fascinating. And much like PRP, and I know you're going to talk about that next, autologous exosome, sort of this next generation, but very similar, so your patients understand, very similar delivery methods to how you deliver anything, right? But where you like PRP, where you can go directly into a local injection or systemically through IV. So I think that's what makes this, that's why you're so excited, right? You're going to be able to treat your patients in a myriad of different ways to truly help them specifically.
Yes, absolutely. This is a targeted application. So there are different ways, like I say, we can do it interarticular. If you have osteoarthritis of the knee, and I've used it on multiple patients for osteoarthritis of the knee and some of the larger joints, it works wonderful. But I can put that exosome right in the joint and it starts to go to work immediately. And the accelerated response is absolutely amazing. I get patients and they'll come back and they'll call me in a week and they'll go, I had one just 2 weeks ago, and she goes, my pain, 20 years of pain, and it's 40% improved in less than a week. That's the power of these vesicles.
Yeah. So tell us about autologous exosomes. So there's a lot, your patients are your best consumers, right? Because they can get so much information. And there is a lot out there on exosomes and the different derivatives of exosomes, but autologous exosomes is really this next exciting thing. Can you kind of dumb it down for us and explain those differences and why you're so excited about this new source of exosomes?
Absolutely. So autologous simply means they come from your body. It's unique to you. So as I stated before, we've used exosomes, or we've known about exosomes and studied them for 30 years, but they've been sourced exosomes. What that means is they can come from a mesenchymal stem cell or placental tissue, okay? Well, it's okay, but understand that that's not yours. And so that increases the risk of some tissue response that is not appropriate, okay? With autologous, look, a simple blood draw, I pull them out of your body, and then we go through the process and we put them back in your body. It is specifically designed for you and will target exactly what you need to have targeted in your body. That is the cutting edge science that we're dealing with, and this is absolutely beautiful in that we now, and we're not circumventing, but we are moving around in a safe space in the regulatory space too.
Exactly. And it truly is the next big breakthrough. And I'm excited to say, as part of, as part of a national research company, that we are the only ones that are using autologous or manufacturing autologous exosomes at this time. So it's a breakthrough, and it's going to be well received and accepted. It already has. So explain, if you will, how the exosomes, the autologous exosomes that you use, PPX, actually works, like how your patients will experience this.
Yeah, the process is very simple, and it's very similar to PRP in that it starts with a simple blood draw, okay? And so we meet in the office, we have our consultation, you tell me what your troubles are, and we decide that we're going to move forward. What happens next? You get a simple blood draw. That's it, simple blood draw. We package that and we send it off. Okay, now the important thing here is that not only is that a simple process, but what happens when it's sent off to this special FDA certified laboratory? That process is very important too. And so what happens is this is the big difference between PRP and PPX or autologous exosomes. I've done PRP for 15 years. We do that in the office. But what we don't know is every spin, what we're getting. When we do it with the process that we're talking with PPX, the process behind it is very specific. We know the concentration of the product, meaning the exosomes are going to what they're going to be, and they are also cultured for microorganisms and contaminants. We look at that. So we know that when that product comes back, not only do I know the amount of what's going back into you, but I know it's safe. And that is a huge process. So how does that work? We simply draw the blood, we package it, send it overnight to Zeo Scientific. They process it through filtering and ultracentrifuges. I call it my NASA process. It's a hugely, complex process, but it's a very defined process. And in approximately 10 days, we get 2 ml, 1 ml vials back of your exosomes. And then you're ready to have therapy start.
I think what's really important to understand, or for your patients to understand, is PPX is the next generation of PRP. So PRP was like the iPhone 1, PPX is like the iPhone 20, right? I mean, it's just the space of medicine has grown, is evolved so quickly. But what you're able to do tableside in your office, like you do with PRP for your patients, you simply can't do that in the office. This has to come back to a laboratory. And in fact, the 7 steps, the sequential centrifugation that we do in the lab, I mean, it's it's like $1 million piece of equipment. It's not something that could be done in the office. So it's important that your patients realize this is the next generation.
Absolutely. Next generation, and it's only for their betterment. It's going to be in a more effective therapy because of the scientific process behind it.
Yeah.
And so that's the beauty of
Yeah. So how safe is it? Is it as safe as
it.
PRP?
Oh, it is actually, it has a high safety profile simply for all the things we stated. Look, we are pulling it out of you, and then not only are we concentrating, but we're looking for contaminants and microorganisms. And so the risk, there is essentially no risk. You're not going to get an allergic reaction to it. You're not going to get an antigenic reaction to it. It is simply very safe because it's yours and you own it. And that is not only safe, but that provides that targeted ability for personalized medicine. It's
Right.
unique to you.
And of course then it's manufactured in an FDA regulated laboratory, a GMP.
Absolutely.
Yeah. So those are all real important things that, your patients wouldn't necessarily think about, but it's a very important. And then just about all the clinical uses, will you tell your patients just in all the different areas that this is changing medicine and changing conditions?
It has the ability to work in every area of medicine. And my practice is being defined by this because I feel so strongly about this that I can help more people overcome whatever, whether it's osteoarthritis, whether it's a sports injury with tendon muscle injuries, whether it's wound healing, hair loss, regrowth, sexual wellness, sexual dysfunction, aesthetics, beautiful for facial aesthetics. Um, and then we also are using it for systemic wellness and optimization. So as we age, those body aches and pains, which are inflammatory in nature, okay,
Right.
can be treated with this very successfully, offering you not only a healthy longevity, but a quality of longevity that is outstanding. So it's used all over the body, just depends on what you need.
And how exciting that this is an option for your patients. I mean, when you think about all the different, types of physicians that you have to see, specialties, right? For all of these different conditions, really of aging. I mean, I mean, you're changing lives, but this is things that we all are getting, right? Hair loss and knee and joint pain and all of these things that are really just indicative of the aging process, and to have something so safe and natural and cutting edge that can really really support longevity and optimal wellness and living. So
That's
it's so cool that Peak Vitality is being going to be able to integrate all of this for their patients.
No, like I said in the beginning, this is a cutting edge therapy. I am so excited to have it and offer it, and I am so blessed to be partnering with you and Zeo Scientific. This is just a wonderful therapy that is only going to get better and more robust as we move forward, and I love having it. And I
Awesome.
hope my patients, will seek me out and come and talk about it. Um,
Yeah, absolutely. And I think, again, as a part of this education series, what I want to make sure that we let your patients know is that whether it's once a month, but you're going to be bringing specific education on, for instance, for sexual wellness, and really kind of dive deep into that and how these new therapies, and it's not just exosomes, but all the different combination of things that you offer at Peak Vitality, like hormone optimization and different combination therapies for specific conditions. And I think that that's what's so unique about you, Dr. Aister, and about Peak Vitality, that you are approaching wellness from a very, very comprehensive standpoint. And I mean, your patients are blessed to have you and have you as a resource, but I want them to stay tuned in, because this is something that this is just the first of many, but we're going to get real specific so that you can help teach them.
No, absolutely. That's the whole goal. This is the early educational process of here's the exosome therapy. I have all kinds of tools in my toolbox that can
Mhm.
help both males and females with whatever problems they're having. And how we use that in combination is what that personalized therapy is going to be. So it can include exosomes. It may include shockwave. Hormones are very important, as we all know. So we use all these tools, and it's over time that we can affect this change, and apply the tools correctly to help people to that healthy and quality of longevity that they want.
So for those patients and listeners that are just listening and not actually seeing the screen with your contact information, please let them know how that they can reach you for a consultation, and your website as well.
Yeah, our website is www.peakvitalityaz.com. You can call. I answer my own phone. Okay. So the number to call for consultation is 480-550-6640. That's the type of practitioner I am. I want I want to minimize the miscommunication that can sometimes occur from the front door to the back desk. And I'm very responsive. But the bottom line, it's a free consultation. We can talk about it. It doesn't cost you anything. But more importantly, if you don't do it, it can cost you something.
That's so true. Well, your patients are lucky to have you. So again, call 480-550-6640 or visit peakvitalityaz.com, and stay tuned, because we are going to continue this education series, and I'm looking forward to being a part of it. Thank you so much, Dr. Aister.
Jill, it's been wonderful. I really appreciate your time and effort, and I look forward to doing more of these with you.
Ditto. Have a great day.
You too.
Bye-bye.
Thank you.